Borderline personality disorder, or BPD, is a serious mental health condition. It affects how people feel, think, and act. People with BPD often have intense emotions. They may struggle with relationships and self-image. BPD can make daily life very challenging, but with understanding and support, people with BPD can lead full and meaningful lives. People with BPD are often very sensitive. They may experience intense joy, sadness, or anger. These emotions can change quickly. This is called emotional instability. BPD also affects how people see themselves and others. They may have a distorted self-image and fear abandonment. Relationships can be difficult for people with BPD. They may have a pattern of unstable and intense relationships. They might idealize others, then quickly devalue them. Living with BPD can be very difficult, but it's important to remember that BPD is treatable. With professional help and support from loved ones, people with BPD can learn to manage their symptoms and build healthier lives. Borderline personality disorder, or BPD, shows up in many ways. It affects a person's thoughts, feelings, and behaviors. Recognizing the symptoms is important for seeking help and getting the right treatment. One of the main symptoms is intense and unstable emotions. People with BPD may experience extreme sadness, anger, or anxiety. These feelings can be triggered easily and last for a long time. This emotional roller coaster can be very draining for the person and those around them. Another sign of BPD is a fear of abandonment. People with BPD may go to great lengths to avoid real or imagined separation from loved ones. This fear can lead to clingy behavior or, conversely, pushing people away. Impulsive and risky behaviors are also common in BPD. This can include substance abuse, reckless driving, or engaging in unsafe sexual activities. These behaviors are often a way of coping with intense emotions or numbing emotional pain. People with BPD may also struggle with self-harm or suicidal thoughts. These serious symptoms require immediate professional help. It's important to remember that BPD is treatable and help is available. While the exact causes of borderline personality disorder, or BPD, are not fully understood, research suggests that it is likely a combination of factors. These factors can include genetics, brain chemistry, and environmental influences. Genetics seem to play a role in BPD, as it tends to run in families. If a close family member has BPD, the likelihood of developing the disorder increases. However, having a genetic predisposition does not guarantee that someone will develop BPD. Brain structure and function may also contribute to BPD. Studies have shown differences in brain regions involved in emotional regulation and impulse control in people with BPD compared to those without the disorder. Environmental factors, particularly early life experiences, can also play a significant role in the development of BPD. Childhood trauma, such as abuse, neglect, or witnessing violence, is a significant risk factor. Growing up in an unstable or invalidating environment can also increase the likelihood of developing BPD. It's important to remember that BPD is not caused by one single factor. It is a complex interplay of genetics, biology, and life experiences that contribute to its development. A borderline personality disorder, or BPD, is a treatable condition. With the right support, individuals with BPD can learn to manage their symptoms and live fulfilling lives. The first step towards recovery is seeking professional help. A mental health professional, such as a psychiatrist or psychologist, can diagnose BPD and recommend the most appropriate treatment plan. Diagnosis typically involves a comprehensive assessment of the individual's symptoms, history, and current functioning. Psychotherapy, particularly dialectical behavior therapy, or DBT, is considered the gold standard treatment for BPD. DBT focuses on teaching skills to regulate emotions, tolerate distress, improve interpersonal relationships, and increase mindfulness. Medication may also be used as part of the treatment plan for BPD. Antidepressants, mood stabilizers, or antipsychotics can help manage certain symptoms, such as depression, anxiety, or impulsivity. In addition to professional help, support from loved ones is crucial for individuals with BPD. Understanding the disorder, practicing patience, and setting healthy boundaries are essential for maintaining supportive relationships. Remember, recovery is a journey, and with compassion and understanding, individuals with BPD can thrive.